name is Erlene Jenica Opo, and for today I will be showing to you the preparation of Ampoule and Vial, and also the different kinds of injections such as Intradermal Injection, Subcutaneous Injection, and Intramuscular Injection. So upon starting the procedure, the first thing we have to do is to check for the doctor's order for any instruction for the medication that we will be doing, and then prepare the tools that we needed, such as the alcohol, the ampule, and the vial, and also the syringes, and the 19 gauge needle and 23 gauge needle, and also don't forget our gloves and the cotton balls and the gauze pad. And after that, we have to verify the right client for the procedure that we will be doing so that we can make sure that we will be injecting the medication to the right patient. Before starting the medication administration, we need first to explain the procedures that we will be doing to the patient so that he or she will know what we inject to him and what is the purpose of it. And then, let us not forget to wash our hands properly so that we can prevent the spreading of the virus and the infection. We can now proceed to our procedure. Let us now prepare the ampule. Let's just flick it a little so that the liquid will go down. Then after that, let's get a gauze pad or cotton swab to open the head of the ampule, and we must be careful so that we will not get injured by the glass particles of the ampule. So when we break the head of the ampule, we have to push it towards us. Push it so outside and break it. There you go. And then throw it in the proper bin. Then after that, let's just put it here. So my 3cc syringe has actually a 23 gauge needle, and therefore we have to change it with a 19 gauge needle. So to prevent the contamination of the needle, we must not touch the needle, and also we have to change the needle in here. There you go, we can twist it, and then there. Then get the 19 gauge needle. So there you go, we can also change it here. Yeah, just twist it so that we can maintain the cleanliness of the needles. Okay? After that, we can remove the cover of the needle carefully so that we will not get needle prick. We can now proceed to getting the ampule. So there you go. Now let's throw it in the proper disposable trash bin. Then let's remove the excess air. Let's wipe it with a cotton swab. Then after that, we will now be changing the needle into 23 gauge needle. Okay, and then throw it in the sharp disposable bin. And then next is let's insert the 23 gauge needle. And just twist it. Then there you go. You have now the ampule on the 3cc syringe with a 23 gauge needle. Next is the preparation of the vial. First thing we have to do is remove the metal, so that we can see the rubber there. And then let's clean the rubber of the vial with a cotton swab. Let it dry. After that, let's get our syringe. And so you know, let's change it into 19 gauge needle. So let's do that again to maintain the cleanliness. So there you go. We have now 1 milliliter of vial. Let's throw it in a proper disposable bin. Let's change it into 23 gauge needle. Okay, there. So the reason why we need to keep changing the needle when getting the medication and upon administering it to the patient is because when we use the needle that is already injected, here in the rubber, it will get dull already, and it will hurt the patient when we inject it to them. So it would be better if we change the needle upon injecting it to the patient. Make sure to check the label and the name of the vial in the ampule when taking it from the cart, before administering and after administering, so that we can make sure that we are injecting the right medication to the patient. Let's start now with the intradermal injection. Before we inject the medication to the skin, let's first disinfect it. Then just let it dry. So upon injecting, let's make sure that there is no air space in the syringe and check if it is working. There you go. Then let's now proceed to the intradermal injection. Okay, so the needle hole must be facing upward and inject it on the skin of the pig. The skin of the pig is actually turning white. There, I have already created a bleb. There you go. That's a bleb. Then remove the needle. Okay, let's use this again. Remove the needle. Throw it in the sharp tools. Okay, so for now, the next thing we have to do is the subcutaneous injection. So the first thing we have to do before injecting the medication is to clean the area wherein we will be injecting the medication with circular motion. Then throw it. Then after that, let's get the syringe. It's already 23 gauge needle. And let's remove the cover. Let's remove it. Let's now inject it to the patient using the 45-degree angle. And make sure that the hole of the needle is facing upward. The upward skin facing us. Okay, 45-degree angle. There you go. And then pull the plunger. And if there's no blood coming out, then we can now continue pushing the plunger, the medication, administering the medication to the patient. Slowly. Okay. Okay. Then throw the needle. The last one that I will be showing to you is the intramuscular injection. Let's remove this. Let's remove the cover, the cap of the needle. And upon injecting the medication, we must hold the syringe like a pen and inject it to the patient with a 90-degree angle. Okay, so let's now do it. 90-degree angle. Here you go. And then push the medication. So let's just push it slowly. And there you and slowly get the needle. Okay, there you go. And then after that, we can now remove the needle again. Make sure that you will not get needle prick and throw it in the sharp tools trash bin. And the syringe is in the proper disposable bin. Make sure that you put the patient in a comfortable position. It's either Fowler's position or a supine position. It depends on the patient's condition and on how you need to administer the injection. So we are now done doing the 3 injections, the intradermal, the subcutaneous, and the intramuscular injection. After that, we have to check for any reaction or allergy from the patient. But of course, before injecting the medication, you have to make sure that the patient has no allergy with the medication that you will be injecting to him or to her. Okay, so for us to make sure that there is no any negative reaction to the patient's body, we have to wait a little for any reaction of the patient. We shouldn't forget to clean the tools that we use, and don't forget to document, evaluate the patient's reaction or any update regarding the patient. And then let us not forget to properly wash our hands to maintain our cleanliness and to not spread the microorganisms to other patients.